Hello, everyone. On today's episode, we are going to be talking about seizures and epilepsy. A seizure is an abnormal electrical activity of the brain, and one or more than one seizure will lead to epilepsy. So, somebody who has had 2 seizures, 3 seizures, they are no longer having just seizures, they are now becoming epileptic or they are now having epilepsy. So, today, that's what we're going to be talking about. As we all know, most people would think, oh, epilepsy is witchcraft. Like in Cameroon, they'll call it jengu or say fainting fit. No, it's not witchcraft. Please, if you're one of those who think epilepsy is witchcraft, from today onwards, have it at the back of your brain or in your mind that epilepsy is not witchcraft. It's abnormal electrical activity. Epilepsy is a common, or I'll say normal, not normal, but a common disease like malaria, like HIV, is something that can happen to anybody. Seizures can happen to anybody, especially somebody who already has it running in their family, or somebody who has had a traumatic brain injury, or somebody with low sodium, anybody can have seizures. So please do not stereotype those who have seizures or epilepsy, because believe me, they did not wish that on them. They did not say, oh, I want to have epilepsy or I want to have seizures. Nobody sits and wishes for things like that. It just happens. And sometimes things like that are beyond our control. So today we're going to be talking about seizures and epilepsy, okay? So there are so many types of seizures: focal, generalized, absent seizures, or seizures of unknown cause or unknown origin. Sometimes we do not know what causes the seizure. Sometimes we can tell, okay, well, this person's seizure was triggered by this. This person had a traumatic brain injury and now they're having seizures. But sometimes, unfortunately, we really cannot tell. So again, nobody wishes this on them. So please do not stereotype, do not laugh, do not make fun of anybody who is having an epileptic fit, or somebody who is having a seizure, okay? So we're going to talk about, well, focal seizure is when just one hemisphere of the brain is affected. Just one small portion of the brain is affected. That's when the electrical activities are limited to that area. And then we have generalized seizure. That's when several areas, or maybe it starts in one area, one hemisphere, and then it starts going to the other hemisphere of the brain. So that's when it becomes generalized. So again, and then we're going to talk about the causes, okay? So we have several causes of seizures. Some of these things, some people who have seizures cannot really tell what actually caused the seizure. We call those ones unknown origin. They do not know what caused it, they're not sure how it happened and all that. And it just sometimes it might happen just once. They might have a seizure one time from nowhere, and the doctors will look for everything possible under the sun. They will not find what actually caused that particular episode. So please, what I'm trying to say, this can happen to anybody. You never know what can happen. So, and when it can happen. So please do not make fun of anyone, or do not look down on anyone who has problems with seizures or epilepsy. Please, parents, family members, if you know anyone in your family that has epilepsy, or that is suffering from epilepsy, or that has seizures, sometimes have seizures, please make sure you get a bracelet, something that they can wear on their arm, somewhere visible, that when they have a seizure somewhere, somebody can see it and say, okay, they're having a seizure, and they can know what to do. That child that has a seizure, let that child carry something, a card or something that you've made. Put it in their backpack or stick it somewhere in their uniform pocket when they're going to school. Because when I was growing up, we had a lot of kids in my school. A lot of them, I mean, they're grown now. Some of them, eventually passed away. That's life. People move on. But we had a lot of kids that had seizures, that were epileptic, and we didn't even understand the gravity of this problem. We didn't understand. Sometimes they'll be sitting in class and all of a sudden they are absent-minded. The teacher will be talking to them, they're not responding. They just have a blank stare. They're just like that for 1 minute, and what happens after that? We make fun of them. The teacher beats them. They tell them to punish. They punish them. They tell them to kneel. They tell them. They say, "Oh, you this cocoyam head. You this stupid child. You're not intelligent. You know." And children will start having low self-esteem. That's how some children ended up dropping out of school, because they couldn't make it. They couldn't pass their exams because they had this problem. They had this they were always absent-minded, absent seizure. They were always absent-minded. And nobody could even tell that this was a problem. Because if you have a child in your class that is, is playing, is acting normal like every other kid, and then all of a sudden they look at you like this. For 30 seconds, you're talking to them, they're not responding. Please pay attention to that child. There's a problem. There's a more severe problem than just a cocoyam head child. Yes, there's a more severe problem than just a cocoyam head child. And then another thing, children in school with epilepsy and all, we don't have nothing to accommodate these children. I'm talking about Cameroon. We don't have any, I mean, back then when I was growing up, some teachers tried to do their best, we have, like my mom, she was a teacher. When a child had a seizure or an epileptic fit or something, they took the child to the office and sat them down. And that was, that was good. But after that, what else? The child goes back, and then the next thing, 2 or 3 days later, or maybe a month later, another child has the same problem. They do the same thing. Nobody really says, okay, what's going on? Let's track all of these children down, take them to a doctor or take them to the hospital and figure out how we can treat this problem. Sometimes we are playing in school, hot afternoon, in the field with rocks and sticks everywhere. You know how we play in Cameroon. Rocks and stones, no toys. Okay. And you're playing, and all of a sudden a child stumbles and falls. And sometimes these children fall on their head. And then we're like, everybody runs away. Hey, Jengu, hey, Jengu. Nobody knows how to treat. We stereotype these children. We look down on them. It's like nobody cares. And sometimes these children can tell that they're about to have a seizure. That's even the worst part of it, because it makes them scared. It makes them afraid. Like some kind of fear grips them. Like, oh my God, I'm about to have a seizure. My friends will run away. Or, people will think that I'm a witch, or I'm something. That's not good. That's not good. We need to start treating people the way we imagine you, yourself, or your child in that situation, and everybody stereotypes them. And so maybe even you, the parent, you don't know how to treat this problem. You don't know how to solve this problem. Some people use traditional herbs or whatever they use, to solve the problem. That's all they know. That's the only way they know how to treat this issue. So now I am talking about this today to create an awareness, especially with my people back in Cameroon. Because right now, as I'm talking, I know people who have epilepsy in Cameroon, and they're still treating them that way. They look at them as if they call people like efulefu, like people who have lost their mind, or lunatics, because they have a brain problem going on that nobody has ever bothered to address, or even giving your own, not even financial support, just moral support, just some kind of shoulder, a hug, compassion, just to show compassion to somebody who is having this issue. Because you're not having the issue does not mean you can never have it, or maybe does not mean somebody in your family will not have it, in the future. That's why it's good to treat people the way you want to be treated, because you never know. Because this epilepsy thing or seizures, it's not something that anybody wishes on themselves, or it's not something that you say because you're doing this particular thing, it will not happen to you, because there are several causes. So one of these issues might grip you on the neck, and then you end up with a seizure. And what if people treat you the way you were treating other people? You see. So today, this is what I'm going to be talking about: causes. Some of these issues are genetic. Like people with high blood pressure, they say if your father has high blood pressure, maybe it will run in your family, or your grandfather or your grandma, things like this usually run in families. I know families in Cameroon, I'm not calling anybody's name, but I know families in Cameroon that have a history of epilepsy. They have a history of epilepsy. And unfortunately, for some of us, we treated these people with these diseases as if they were not human enough. No, we are not supposed to do that. We are not supposed to do that. So number one cause of epilepsy is genetics. Some people have it in their family. They have it in their genes. Unfortunately, genetics is something you cannot change. You cannot change your gene. You cannot get up and say, oh, my mom had cancer, so I have to remove that cancer gene. If you have, you have, I mean, there's certain things that you will do to, of course, maybe doctors will treat, they'll follow you up and do labs and make sure you do not get that disease that your mom has. Or even if you get the disease, they'll try to detect it earlier so that they can treat you appropriately and prevent damage or death. That's the same thing with epilepsy. Some of these kids do not call this on themselves. Even the adults that have it, of course, kids who grow up to adults, they do not wish to have epilepsy. It just happened that their family had a problem, had a gene of epilepsy, and that went from one generation to another. So please, that's one cause of epilepsy. Number two is just like the structural, makeup of the brain. Sometimes you have people, a normal person can start having seizures, and you'll be wondering why. Somebody who has had an accident before, somebody who has a traumatic brain injury, like they fell from a tree. In Cameroon, we like to climb up trees. A child falls from the tree, and a few months down the line, they start having seizures. That could be a problem. That could be a function, a structural problem, like maybe something has, distorted from the brain that is causing the child to have seizures, and it's beyond their control. They weren't born that way. They didn't have any gene of seizures or epilepsy, but because they fell off from a tree, or they got hit by a car, or they were involved in a very terrible car accident, that caused them to have this brain problem. And like I have said, a seizure or epilepsy, a seizure is an abnormal electrical activity of the brain. So when they have this structural problem, or maybe they fall and they hit their skull, of course, something starts happening and they start having these abnormal activities. So we have to be very careful the way we treat people with seizures and epilepsy. The next thing that will also cause people to have seizures or epilepsy along the line, or as they grow older, is metabolic issues. Metabolic issues like maybe low blood sugar or low glucose, or severely low glucose. That can even cause somebody to go into a coma. Or they have low sodium or low calcium. These are electrolytes that will help your brain, your body to function. It will help your memory. It will help your muscles and all that. So if you have low sodium and low calcium, that's why people who have low sodium, they sometimes behave as if they have altered mental status. When their sodium is too low, somebody who has very low sodium, you ask them their name, they cannot tell you. You ask them where they are, they cannot tell you. It's not because they are crazy. It's just because they have very low sodium, and that is it's making them confused. That's an emergency. If you wake up in the morning and you call your child, Agatha, they respond. And then in the evening, they start behaving abnormal. That's a red flag. They're not playing it. They're not playing a card. And even if they're playing a card, you have to take them to the hospital to actually let the doctor tell you, oh no, the child was just playing a card on you. You don't have to assume. You're not a specialist, or even if you're a specialist like me, that I'm at home, if I get up in the morning, my child is acting normally the way she's supposed to act, and then all of a sudden she starts acting different, I wouldn't say, oh, she's playing a card on me, or no, I'll take her to the hospital, because I know that's not my child and that's not how she behaves. So low sodium, low calcium, low glucose can also cause people to have seizures. And that's why they usually say do not give. And seizures, children in the womb, babies in the womb can also have seizures. And seizures can happen to anybody. Imagine a newborn baby having a seizure, or a baby that does not even know anything, an innocent child having a seizure. This is just to say nobody calls this on them, because imagine an innocent child, having a seizure, or having something that they don't have any control. They don't even understand what's going on with them. They are still young. That's why they usually say do not give water to babies, because, of course, if you give water to babies, that alters their electrolyte. If you give them water, of course, that will, dilute. Let me use that word. Dilute their electrolytes, their sodium, and then they'll start having all these altered mental status, confusion, seizures, and all that. For example, let me give you an example. Sodium is salt, right? You're supposed to have salt in your system to function. I mean, normal level. If you have extra, then you start having other issues like hypertension, hyperkalemia, problems with muscle, you know. So please make sure your sodium level is normal. I'm not saying you should go and be drinking salt water. I didn't say that. So this is what I'm saying. If you take a cup of salt, you put water in it, to a certain level, you'll still be tasting the salt, right? But if you put water it takes a little cup of salt and you put a gallon of water, of course, that you wouldn't get the taste of salt anymore because the water will be too much the salt will not be, the water will be too much for the salt. That's the same thing when you drink so much water, you deplete yourself of sodium. It will cause you to have excess water in your system and you pee out your sodium and and that will cause you to have seizures. That's another issue. And then another one is immunity, immune problems, encephalitis, like brain problem. People who already have infections in their brain, of course, they can also have seizures. And then because the brain is supposed to be sterile, like brain is not supposed to have any bacteria. It's not like your skin that you say, oh yeah, my skin, I have how do they call it? I have this bacteria, yeah, I have staphylococcus on my skin, I have this one, streptococcus. No, some of these bacteria have their norm, they can be on the body, they can be in the gut, but in the brain, we don't expect anything abnormal to be in the brain. Brain is supposed to be clean. So if you have any infection in your brain, then of course there's a probability that you start having seizures. So some of these kids who have seizures probably have some kind of brain problem going on, brain infection going on. Another thing that can cause these seizures or epilepsy, infections like HIV. Of course, HIV does a lot to your system. Some people will have, because HIV, when that virus attacks you, it attacks your immunity, attacks everything. And sometimes people with HIV start acting like they're crazy. They lose their consciousness. Sometimes they have abnormal electrical activities. And when they keep having this, they start having, of course, new onset of epilepsy. Another thing that can cause you to have seizures and probably epilepsy, sicknesses like malaria, diseases like malaria, TB is tuberculosis, malaria, tuberculosis, meningitis, sepsis. When your temperature gets too high, then you are bound to have a seizure. When your temperature gets too high, you are bound to have a seizure. That's why a lot of kids, when they are sick, temperature goes too high, they start having seizures. Convulsion. You know that thing they call convulsion in Cameroon? That's seizure. And when they keep having it, each time they are sick, they have it. Each time they are sick, they have it. Each time they have it, of course, it destroys something. Just imagine if you repeatedly hit something like this, of course, this will have an effect, and this area will have an effect if you constantly do this. Constantly. That's why you do not let your child have a high temperature. If your child is running a temperature, if your child is having a fever, or they're having malaria, you need to treat it. Because when you let their temperature go too high, of course, you're indirectly causing a damage to their brain. You don't know it, but you're helping the brain to start having other issues. That's why sometimes you see kids who pass out because they've had fever for so long and nobody has treated it, or they've had malaria for so long, malaria plus, as they say in Cameroon. That's why you need to handle these issues immediately. A child has meningitis, you need to handle these issues immediately, because if you do not handle these issues, then your child or your neighbor's child is bound to have some kind of seizure. They're about to have a seizure. And guess what? They can have a seizure and even die in the process of that. They'll say it's witchcraft. It's not witchcraft. Or they'll say Happy King Josh should also straighten his skin so die. That's a seizure. They had a seizure. Or a child will just sit like that, relax, and die. They've had a seizure. Because there are different ways seizures can manifest. epilepsy, all these things, there are different ways they can manifest. Do you know that? They can have jerking movement. When I say jerking movement, like this, you know how can I even put it? Jerking movement, just do like that. And they die. And they say, hey, that child was fine in the morning. All of a sudden, they had a small fever and they died. No, it's seizure, epilepsy that has killed that child. And because nobody was paying attention, or because we are too ignorant, or because we are too sophisticated with our mentality, because everything is witchcraft, it's not witchcraft. We have to start getting out of that little box, think outside the box. Everything is not witchcraft. Of course, I do not dispute the fact that there's witchcraft. I know there's witchcraft, but not everything is witchcraft. So that's another thing. Okay, that's another thing. Infections can cause seizures and can lead to death, especially in children. That thing they call convulsion. That child keeps having convulsion. That's a kind of seizure. Okay, another thing I'm going to talk about is how these seizures will manifest. I have mentioned before, sometimes kids who have seizures, they are, absent seizures. You're talking to a child, you're having a conversation, all of a sudden they go. You're talking to them, they're like that. And then they're like, were you talking to me? If they keep doing that, they keep doing that. That's why most of these kids don't perform well in school, because they are absent-minded. Sometimes the teacher will not even pay attention. You know how in class in Cameroon, there are like 100. I remember when I was in class 7, we have like 100 of us in one class. Sometimes the teacher does not even pay attention to the people in the middle. Those of us in the front and those in the back, because backbenchers, they're usually committing all the crimes. I'm not saying they were always, I'm just saying the backbenchers, and they're usually the bigger ones, like taller or maybe age-wise, So everybody's attention is either the ones in front, like the short ones, I will not call names, short ones, they put them in the front. And then the ones that are average height, they put them in the middle. Then the ones that are really tall and, they put them in the back. So some of these kids will be having issues going on and nobody's paying, because the class is too big. I mean, unfortunately, I cannot solve that problem. But I can at least tell the teacher, if you have this one child in your class that you always think this child is absent-minded, then there's probably an issue going on. Okay, so seizures can manifest in different ways. Seizures or epilepsy, absence seizures, kids like that, they black out. You're talking to them and they are just like, they're off. It's not because they don't want to listen to you. They're not ignoring you. There's probably a problem, an underlying problem, a more severe problem than just a child ignoring you going on, okay? And then we also have, we have generalized seizures. Generalized seizures can manifest as tonic. They're just stiff like that. A child all of a sudden is just stiff. That's a tonic. And then you have, clonic. They are contracted. I wish I had pictures. And then we have, of course, myoclonic. We have tonic-clonic, like they are stiff and contracted. And then we have the atonic. They are just relaxed and they are just like this, Sometimes the kids are like that when they pass out, when they have the seizure, when they have the fit going on. They can be like that, They have different body postures that they use. And see, a body posture that is not upright and normal should be an alarm, should ring a bell to you. Like if you have a child that all of a sudden just falls and, they start jerking like that, or they're clenching their teeth, or, that something should tell you that something is not right. And the way you have to handle this situation is not by running away. It's not by running away, and it's not by yelling, oh, wish, or jengu, no. It's by calmly helping that person, because like I have said before, sometimes they are aware that they're having a seizure, but they cannot control it. And sometimes they're not aware. They don't know. The seizure just takes them unaware. And, sometimes their eyes roll back like that, like roll all the way. I've seen it before. I've seen it as a child. I've witnessed people having seizures, but I couldn't help them because I didn't even know what to do. And as a grown-up, an adult here in America, I've witnessed people have seizures. Of course, I've helped them because now I know what to do. And that's why I'm bringing this information so we can kind of eliminate some of the stigma or the stereotype that have been going on for a long time concerning people with seizures or people with epilepsy. So seizures can manifest in different ways like that. And if you've seen somebody who's had a seizure, or if you've seen somebody who has had epilepsy around you, you already know what I'm talking about. Sometimes they have stuff coming out of their mouth. And guess what? Can you believe that before we used to run away, that thing is contagious? If that thing touches you or if their saliva touches you, you're gonna have epilepsy too. Well, that was really bad because of course ignorance is not bliss, you know. There's no excuse for it. Now that I know, I really regret, I really feel bad for these kids. I really feel bad because some of these kids, you see a child that is like, 10 years old, they're still in class 3 because they cannot move forward with their education. I'm not saying every child that is 10 years old in class 3 has epilepsy. I'm just saying that some of them that I know of, they could not, academically, they were doing very poorly. And now I know, I feel so bad, I feel terrible because some of these kids were struggling, but they couldn't make it because of the condition they found themselves in. Because of course, it's hard to study when all of a sudden, boom, you're having a seizure. You're reading chapter 1, history is a study of this. All of a sudden, you have a seizure and you find yourself in chapter 10. How do you expect to pass an exam? How do you expect a child to pass it? Because they're confused. They don't even know where they are. Sometimes they get up, they don't even know where they are. They don't even know their names. They don't even know who they are. And we laugh at them. That's not good. Okay. So I've talked about, sometimes seizures, of course, you don't know what causes them. You don't know what causes the seizure. So sometimes the doctors just treat the problem. I was talking to somebody the other day and she was asking me about this epilepsy issue or seizures because she said, she has a friend and they were just sitting the other day and her friend just collapsed. The friend had a seizure. And this friend has never had a seizure. She doesn't have any family history of seizure. They took her to the hospital. They tested her. They did everything possible. Of course, this person is abroad. It's not in Cameroon. They did everything possible to figure out what might have caused that issue, that seizure at that time. And believe me, in a first world country, they couldn't figure out what caused the problem. They couldn't figure it out. So this can happen to anybody at any time. Okay, it can happen to anybody at any time. So this is why I am talking about it today, because some of us have been ignorant for so long. And I learned a lot actually reading about these seizures and doing research. I learned a lot. Fortunately, because of time, I cannot say everything here. Okay, so what was I even talking about? Okay, I was talking about seizures. So yes, treatment. If you have seizure the first time, you have to go to a doctor so that they can figure out what happened. At least even try and go to the doctor, because if they say, oh, we couldn't figure out what, at least you have gone. Because what happened is you might have it again along the line. You might have it again. And if you keep having it, one day we don't know where you will have it and what will happen. So please, and people with seizure or epilepsy, they're usually afraid to have it in water. They're usually afraid to have it in, because you know how water is. They can drown. Imagine if you seize in water, you can drown. So if you see somebody swimming and doing this, do not run away. Do not. Try to save that person. Take them out of the water, put them somewhere, lay them to the side. I'll get to that. So I'm talking about treatment. Some people use traditional medicine, or I don't know if that works, because as far as I know, most of the kids that were having all this epilepsy and seizures when I was growing up, they were using the leaves and all that. They kept having, these issues. So I know that there are neurologists. Neurologists are people who study the brain, spinal cord. They study So there are neurologists and there are medications that people can use, anticonvulsants, anti-seizures, or anti-epileptic medications. You can call it anyhow you want to call it, but there are medications that medical doctors, specialists will prescribe to you based on how bad or how severe, or based on your medical report. They'll prescribe these medications to you and you'll be taking them. Also, they can do something they call nerve brain stimulator. That one, they put it in your brain to capture the seizure and prevent it from happening. Also, they can do surgery. Another thing that can also cause seizure is a tumor. People who have brain tumor, sometimes they seize. All of a sudden, you see somebody who has been fine, all of a sudden they have a brain tumor or something growing in their brain, and that starts making their brain to start acting abnormal. So sometimes they go and remove the problem. Surgically, they remove the problem, and that will hopefully, with the hope of helping, stopping the problem. So stopping the seizures. So they remove the problem. So sometimes the seizures could be a symptom of a problem, could be a manifestation of another problem, like a brain tumor. And then another thing, I'll talk about how they can diagnose seizures. They can do a CT, MRI for people who have brain tumors. They can detect that, okay, we did an MRI, I found a tumor. Probably it's the tumor that caused the seizure. Yes. And then they can do an EEG, electroencephalogram. That's they hook you to some monitors, and they monitor your brain activity for a couple of hours. And your brain activity, usually with this machine, they can detect abnormal brain activity, aka seizure. Abnormal brain activity, aka seizure. So that's one way. If somebody comes to the hospital and say, oh, they're having a seizure or they've had a seizure, the doctors will usually use that to determine, the magnitude or the magnitude of the seizure or the cause of the seizure, or whatever they have to do to find out if you actually had a seizure. Because sometimes people lie that they've had seizures in America. People lie. They tell all kinds of lies, So, and they usually tell lies like that to get away with stuff. But I know my people in Cameroon, I know people usually will not tell people. Somebody will not come and lie to you that they have epilepsy, because it's a taboo. They consider epilepsy as witchcraft, so nobody will ever lie that they have epilepsy. But people do it. Okay, so they put that there. Of course, that's one way to determine, and then they'll get information from you based on what you tell them, your family history. They can easily tell if you have a history of seizures and epilepsy or not. Okay, and then if you tell them, maybe you've recently had a traumatic brain injury or damage, or you fall from the 20th floor, you fell down and hit your head, or you were trying to climb a tree and you fell. So, so they can easily tell too. All right, so now I am going to talk about what to do if somebody has a seizure. I've already said people who have high fever, systemic illnesses can have seizures, okay? So, all right. So now I am going to talk about what to do and what not to do when somebody is having a seizure. This is my favorite part, because we have many myths about seizure. We have many people have their own ideas and mentality about seizures. Number one, if you are a patient, or if you have seizure, or if you have somebody having a seizure around you, or if having an episode of epilepsy around you, please make sure you get help. Make sure you get, immediately they start seizing, make sure you yell for help, or if you are the person that is about to have a seizure and you are aware, you can tell that thing is about to come. That awareness, that aura, you can tell you can always tell somebody, I feel like I'm about to have a seizure. Make sure you vocalize it. Make sure you let somebody know if you're among people, so that people will not run away thinking because people are crazy sometimes. People will run away. And then if you're having a seizure longer than 5 minutes, if you have a seizure longer than 5 minutes, it means there's a problem. There's a problem. Because, of course, they say these seizures they are not supposed to last longer than 5. If you have a seizure that is going 30 seconds, 1 minute, then up to 5 minutes, then there's a problem. You have to seek medical help, because after that seizure, probably there's a damage that has happened due to the length of time you've had that particular seizure episode. So make sure you get help. And then if you're around somebody who has a seizure and doesn't regain consciousness within 5 minutes, of course, you have to get help. And then if you're also around somebody who has had a seizure and then they come back to life, they're talking to you, but they're still not making sense. They're still themselves. Even if that seizure didn't last up to 5 minutes, you still need to get help because probably something might have happened. If you're around somebody who is about to have a seizure and you see them, going dangling like that, like they're about to fall, just support them to your ability. At least ease them to the floor. That's how I'll say, so that they should not fall and hit their head. Because when they fall and hit their head, they can have intracranial hemorrhage, intracranial bleed. That can also cause seizure. Okay, they can have injury to the brain that will cause seizure on seizures. You get the point? Or they can have some kind of, that brain damage, or they can have some kind of wound to their head, and then later on that can be infected, and that's another problem. So if you are around somebody who is about to have a seizure, please just help them to the floor quietly, and then you scream for help while helping them. And then another thing is, when somebody is having a seizure around you, when you ease the person to the floor, turn the person to the side. Why? Sometimes people have seizures, they're having all the saliva, coming out of their mouth. So you don't want them to choke on it. They lay like this. Imagine you have saliva full in your mouth, or spit, or let me say water, and then you're having this seizure and you're like gargling on it. You can choke on it. They can be aspirated and it can go to their lungs and cause some kind of lung infection. So please turn them to the side. What did I say? Turn them to the side. That's another one. And then somebody who has had a seizure, stay with them until they are fully awake. Even if you're going to church, even if you're running late for church, stay with them or take them with you. Because if you leave them there, you don't know what might happen. Maybe they are not fully awake. Maybe they're half awake. They are in half conscious, and that can cause another problem. They can run into the road or dive into the water and cause more problem because their brain is still not functioning right at that time. So stay with them until they are fully awake. Ask them their name, their date of birth, ask them where they live, ask them, where they are at the moment, ask them what the time is, ask them what year it is, ask them the name of the president. Of course, nobody will forget the name of Pobia. If somebody says the president of Cameroon, Amadou Ahidjo, after having a seizure, then there's a problem. Please, that was not a joke, but I'm just saying, it's funny, but that's an issue. Okay. And then if you have, of course, if you're around where, there are dangerous objects, maybe like they are on falling on rocks. You know how Mutengene has a lot of stones. You see somebody dangling like that, they're almost quarter to fall. Please help them down. Let them not hit their heads on the stone. I've had people have seizures in class and they fell on the bench and they hit their back. On top of the seizure, they hit their back or they broke their bone. You see? So please help them not to have further damage, because that can cause further deterioration and more problems on top of problems. Seizure is already a very big problem on its own. So please, we do not want a broken bone or a broken head. And then another thing you have to do, if they have eyeglasses or they have tight clothes, sometimes people will fall like this, face down, they have eyeglasses, you see them, please take the eyeglasses off because that can injure their eyes. Imagine you having seizure, now you have eye problem. No, that's a lot of problems for one person. Okay, so if they're having seizures at that point with glasses, please remove their glasses. If they have tight clothes on, please free them so maybe they can breathe. Or I'm not saying you should expose their body parts, their private parts, but please take off that tight shirt. And then another thing you have to do, time the seizure to know how long it takes, because with that, then the doctors can determine how to treat them and can determine if the seizure lasts longer than 5 minutes, then they can tell there's a further problem to be discussed. And then another thing is, if they're in water, please remove them. If they're in around fire, please remove them, because you don't want them to fall in fire. Fire will burn them. Or you don't want them to fall in water, they will drown. I'm not saying they will drown, I'm just saying they might drown. Okay. And then what not to do when somebody is having a seizure. What not to do. Number one, do not put anything in their mouth. I remember when children used to have convulsion in Cameroon, they'll take a spoon and put it in their mouth. That can injure their teeth because they have this belief that they'll swallow their tongue or they'll cut their tongue. I don't even know what they used to say. I don't know. They'll say they'll swallow their tongue. You cannot swallow. How can you swallow your tongue? Let me see. You cannot. So do not put anything in their mouth because that can even cause, because like I said, some of these people, when they're having these seizures, they're aware. So they'll be fighting that thing that is in their mouth. It can destroy their jawbone. It can even choke them. Don't put anything in their mouth if they're having a seizure. Whether it's plastic, spoon, paper, towel, nothing. Do not put in their mouth. Cloth, do not put. Let them have their seizure peacefully. And then after that, you can help them. Number one. Number two, I know they take the child to the bath. When the child is having convulsion, they take the child to the pit toilet and turn them upside down and put their head in the toilet so they can inhale that smell. And then that smell will slap their olfactory or their nose, their senses, and bam, they'll wake up. Please, do not do that. You know, turning that child upside down. They said it used to work for kids. I never seen any child that they put upside down in the toilet. I've heard that they took the child to the toilet and what did they do? Immerse them, turn them upside down and put their head in the toilet, and they came back to life. When somebody's having a seizure, they're supposed to be on their side, not head. Imagine what all the things that they have in, they're eating all day long, and it will just come out like that. Some of you will come out to their nose, or you won't go to their lungs. Please do not do that. Do not. Somebody having a convulsion, a child having a convulsion, high temperature, make sure you bring down their temperature. Slowly bring down their temperature. Put them to the side. Turn them like this to the side. Do not put anything in their mouth. And then another one is, do not do CPR if there's no evidence, there's no point that you need to do CPR. You know what CPR is? It's cardiopulmonary resuscitation. There's no evidence that they are having any cardiac arrest or any cardiac issue going on, like, oh, they cannot breathe, they don't have a pulse. So do not do any CPR. If somebody passes out beside you, it does not mean that the fact that somebody has collapsed beside you does not mean that they are having a cardiac problem or they're having cardiac arrest and need a CPR. You have to assess and see if this is a seizure. If it's a seizure, do not do anything. If they do not have any pulse, of course, if somebody passes out beside you, if you see somebody laying down, you check their pulse, you check their breathing, then you proceed to do the things that you're supposed to do, like CPR if it's necessary. If they're having a seizure, they do not need a CPR. Another thing that you should not do not give somebody water or food when they're having a seizure. They can choke and they can die. Do not do that. And you don't want somebody's life to be, somebody's death to be your responsibility. Something simple that you could just solve. So, with that said, how can you prevent seizures? Please, sometimes we can prevent things if we know the cause, or, like I said, people who have brain tumors, they go and take the tumor, of course. People whose seizures are being caused by the presence of brain tumor, they can go inside their brain and remove the seizure. I'm not saying you should go inside their brain. I'm saying the experts can go into the brain. Neurosurgeons, that's people who operate the brain, can go into the brain and remove the tumor. Bring the tumor out. Maybe that will stop the seizure, or they can do a nerve brain stimulator that will stop the seizure. Or people who maybe they get stimulated by stuff. Maybe when there's too much noise, they seize. They have a seizure. When there's too much light, they have a seizure. Those people can avoid certain environments like that. They can avoid it. And of course, if you can prevent it. Prevention is better than cure. Some people just take your medications and that will be fine. You'll be all right. At least, I'm not saying you'll be 100% all right, but at least if you're supposed to have seizures 10 times with medications, maybe that will bring the seizures down to 2 times, instead of 10. So taking medications, of course, will prevent the seizures, And also, people who have seizures should know the triggers, should know like I would say, master your auras. When I say master your auras, like master the things that happen before you get a seizure. Master those things. Like maybe you start smelling something that is not there, or you start seeing things that are not there, those are the kind of auras I'm talking about, and then, of course, know the symptoms of seizures. If somebody tells you, oh, I'm smelling this, and then they start telling you, I'm seeing this, on this, they start sweating profusely, their pupils are getting bigger, they are rolling their eyes, or they are jerking, or they are stiff, or they are just relaxed, they are just flaccid, those are the kind of things that you should be looking for. And then if you have anybody if you have a child or you have anybody that has these seizures in Cameroon, I'm talking about people in Cameroon, and you need a bracelet for this child so the child can carry on. The child will have to put the bracelet on, and I'll talk to you privately one-on-one. If you know anybody, or if you know anyone, if you or any of your family members have this issue going on, please contact me for more information. Thank you for your time. Thank you for the feedback, and thank you for the subscriptions and shares. Please make sure you like, share, and subscribe. If you need help subscribing, please ask me and I'm going to let you know. I'm going to tell you how to go about it. Again, I am Fidelia Nabinita Quine previously, and I am that NP from CHAM. See ya.